There we go.
All right. So, hello everyone. In this discussion, we'll talk about how TCM helps infertility patients to increase their chances of getting pregnant through both natural approach and through in vitro fertilization, which is called IVF. And today we welcome another TCM practitioner, Dr. Daniel Hamadani, to talk about this topic specifically because that is the focus of his practice. So Daniel is the owner and acupuncturist at Fertility LA. Hi, Daniel. How are you?
Hello, May. Thank you so much for having me on.
Sure, absolutely. So I just start. Daniel, what kind of patients do you normally see in your practice and like age groups? Because we're talking about infertility, right? From 30 to 40, 40 to 50 or above. So how do you help them?
So in my practice, we typically see women between 30 and 40.
Oh.
And we help them with acupuncture and herbs,
Hmm.
cupping, supplements, lifestyle, and diet changes.
Oh, wow. Okay. And so you also say you told me once that you work with gynecologists as well, right? So what you just mentioned, those are natural approaches, right? And then so with gynecologists, what do you do?
So gynecologists are sometimes in a tough spot. They
Mm,
often don't know where to refer besides IVF.
mm,
In the US, an infertility diagnosis, if you're under 35, you have to be trying for 1 year or
mm,
have 3 miscarriages. And that's kind of a sad thing, is to try for so long or
mm,
to have 3 miscarriages before you can start infertility treatment.
mm,
And I think that's where TCM can really make a big difference, because there's a lot of things that we can do today that will
mm,
make a big difference down the road so that you can conceive and sustain a pregnancy naturally.
Okay. What do you think, the cost of fertility these days?
Well, I think it's higher in Los Angeles and, major cities. Um, from what I understand, an IUI around here is about 2,000 per try, and
Mm,
that only has a 10% success rate. IVF, I think it starts at 22,000, and that doesn't include the cost of drugs, which could be another 3 to 4,000. And that's about a 35% success rate per try, right?
mm, mm. Wow, that's very expensive. I do know they're expensive. I didn't know that expensive. Maybe in different state. But anyway, very high cost for the family. And so I think that's why a lot of patients will prefer to come to us at the same time, just because relatively we are cheaper. And GCM does do a lot to help them. I don't know, do you see, I mean, in your practice, right? I see numbers, everywhere. So in your practice, what do you think the success rate really is with or without the help of TCM? I mean success rate of IVF generally.
IVF generally is about 35% success rate on its own.
Mm-hmm.
Fortunately, in the United States, all fertility centers, all IVF centers must post their success rates online.
Oh.
So we do have access to that data.
Mm-hmm.
With TCM, so the TCM approach is always about figuring out the underlying problems. So people, they call me and they're like, why am I not getting pregnant? I don't want a band-aid solution like IVF or IUI.
Mm-hmm.
And then they say, my diagnosis is unexplained infertility.
Mm-hmm.
And then I explain that your period plays a role in fertility. And then they say, oh, that seems like voodoo. That seems strange. Can that really make a difference? And yes, it can. And with TCM in my practice, we often see a 150 to 250% increase in the chances of getting pregnant
That's a
after
lot.
their treatment plan.
Yeah, that's a huge number. Okay. So what I saw, I can share some numbers with you. It just I don't know how current the data is, but I don't think it has been changed too much. If you see the numbers posted by alternative medicine, and sometimes they call CAM, so alternative basically, and complementary medicine, they will say with acupuncture, the success rate of IVF it's like 60 above 60%. Without it is about 30 something percent, which is similar to what I understand. Even that's like for all these years. So like 20 years ago it's probably the same number, and now I still see the similar number, although I mean some other study they post by some other clinics, they said it's really uncertain whether acupuncture helps. I have to say, if you do a clinical trial with or without just acupuncture, I think the number is it's hard for us to judge. The reason is TCM includes a lot of things. Very often the patients are fatigued and deficient, so only acupuncture is not enough. So basically, I think the herbs, moxa actually helps a lot in boost the energy level, and that helps a lot in getting pregnant. And sometimes, I mean, in the TCM terms, infertility can be caused by young deficiency. Basically, is the cold, internal coldness. The patient might feel cold hands and feet for years. I mean, girls have that problem for a long time. One thing is because they lose a lot of blood every month and they don't really take care of themselves. And the diet we have here, a lot of people, including me, that's really not very good habit is drinking and eating a lot of cold stuff. And that actually does, disturb. And what I see also in the clinic is people don't really know how things are related. So we actually tell them things, we follow the stages before IVF. So if they just come to us and say, I just want your help so I can get pregnant naturally, then we do a lot of like herbs, acupuncture, etc. But before that, we need them to do a lot of tests. I believe you asked them to do the same things like basal temperature and test your hormone, make sure everything is normal, menstrual cycle, do they actually menstruate regularly or it just like random days? And then it's very hard to predict when you're going to ovulate because that is actually an indication of internal conditions. It's just messed up basically. So I do, like I said, a lot of hormone use or overuse of hormones at very young age can actually destroy the menstrual regularity actually. Okay, that's just what I see. Yeah.
Absolutely. A
Yeah.
lot of women with miscarriages,
Hmm.
unfortunately, 1 in 4 pregnancies will end in a miscarriage.
Really? I didn't know that. Wow.
And we to sustain a pregnancy, we need the corpus luteum to secrete progesterone.
Mhm.
If women are very tired or have low body temperature, some kind of hormone dysregulation, maybe they're estrogen dominant from all of the toxic products that we're exposed to,
Mm.
the corpus luteum won't be able to secrete enough progesterone to maintain the body temperature necessary to sustain the pregnancy.
Mhm.
And we do have studies in TCM that show we can reduce that risk in half with just herbs and acupuncture.
Absolutely. Totally believe that. We have a bunch of herbs that just, tonify kidney young. And I do know some guys, they use very high dosage of young boosters in treating infertility, and they have very good success rate in doing that. And sometimes I wouldn't even recommend that because some of them are maybe, so-called toxic. So I will be very careful, but some of the people, they are very familiar with those herbs so they can have a better handle on those herbs. And so far I've seen them, doing that pretty successfully. Well, that is what it is. And besides that, actually, I think for myself, okay, I don't know, I would like to ask you, do you participate during pregnancy? Because for me, I'm a very conservative person. Basically, I prefer to do it prior to pregnancy. So once the patient is pregnant, we try not to disturb the pregnancy. And then I come in after the delivery. So then to help the mother to regain her physical strength. And that's mostly what I do. What about you?
Personally, I love to see the patient during the first trimester, especially
Mm,
if they have a risk of miscarriage.
right.
Um, we're going to avoid all toxic products
Mm,
during pregnancy, but no,
mhm,
generally I do because there's a lot of symptoms of pregnancy, right?
mm,
Headaches, bloating,
mm,
fatigue, seizures, all kinds of
mhm,
things can happen during pregnancy, and
mhm.
it's better that, in my opinion, it's better to take the natural approach with acupuncture um, than to take the drugs.
Right, right. Absolutely. Okay. So do you do anything like to during delivery or to promote labor kind of thing, and then after giving birth?
Oh, absolutely. I love to use our forbidden points
Exactly.
right before their. I had a patient last week that was going into labor, or she was about to be induced because she was 2 weeks post her due date, and
Okay.
she really didn't want to, be induced medically. She wanted to
Right.
have a natural birth, and
Okay.
so for 3 days straight, we did the forbidden points to stimulate
Right.
the downward motion, stimulate the
Right.
uterine contractions,
Right.
and after the fourth day,
Mhm.
she went into labor. She arrived
Mhm.
at the hospital 10 centimeters dilated, ready to
Mhm.
go, only
Mhm.
had to push for 45 minutes and then went
Oh,
home the next day.
wow. Okay. Well, that's great. And yeah, that really showed the strength of TCM.